So welcome everyone. We're going to have a discussion on health insurance. And in this session, we'll look at the definition of health insurance, the main types of health insurance, and then look at the benefits and limitations of health insurance. And then we look at what are the things that you will need to consider in choosing a health insurance plan. And then we'll also look at the concepts to do with deductibles, co-payments, and then co-insurance and out-of-pocket maximums. Okay. So health insurance. Okay. Health insurance is a form of insurance that covers the costs related to medical expenses for an individual or for a group of people. So basically, what happens is that in insurance, you guard your business against any risk or uncertainty. So if you probably run a business, you don't want to encounter a risk that may lead to the closure of your business. Okay, so you insure your business for risks associated, let us say, with fire, with issues to do with damages that can happen to your, let us say, building or your property, whatever it could be. So in health, we apply the same principles. We need to safeguard our health by insuring it. When we insure when we get health insurance, what we are basically doing is to avoid those expenses that come unexpectedly, and then that can cripple us financially. So we go for health insurance in order to protect ourselves from the financial burden of having a health problem in an unexpected way, or even protecting ourselves in issues to do with chronic health problems. Okay, so this is how it works, and you are in health insurance. It works on the principle that you have many people bring their resources together, which you basically call pooling. Okay, so they bring their resources together, and then out of those many people, a few of those may fall sick, and then the resources that have been pooled can be used to treat those that have fallen sick. So that means that the person who has fallen sick may not feel the pinch or the financial pinch related to the costs associated with the treatment of the condition. So that is how health insurance works. Many people bring resources together, and then a few of those who get sick, those resources are picked and then they are treated. So what are the key terms used in insurance? The first one is premium. This is the monthly amount that is actually paid for the insurance coverage. Okay, so if you get insured for your health, when you go to see the insurance company, the insurance company will tell you to pay a fixed amount of fee, a fixed amount that we call the premium. Okay, so that premium is collected on a monthly basis. Of course, you can pay a full year at once, depending on the plan. Okay, and then it is actually it is calculated based on what one could pay on a monthly basis. So that is the premium. So the premium actually varies depending on the plan that you have. Okay, is it Is it an insurance plan that covers all medical services or specific medical services or for a chronic condition, or it can be for anything. So the amount or the premium will actually vary. And then you have what you call co-payment, a fixed amount you pay for each service or visit that you make. Okay. So for example, if you get malaria and then you go and see a health professional, it may be determined that for every visit that you make, you will pay 20,000 SSP. Okay, this amount is very important because it helps in regulating the usage of medical services for people who have been insured. Insured people tend to visit health professionals more often. Okay, and therefore this could put the insurance company at a financial risk because they have to pay for every time the client visits the clinic or the hospital. So in order to deter people from having to frequently visit the hospital, they have to pay a given fixed amount for every visit that they make. So someone will have to evaluate whether they really need to go and see the doctor or not. Okay, so that is a co-payment. And then we have what you call co-insurance, the percentage of the cost you pay for the covered services after meeting the deductibles. So here, let us first look at the word deductible, which is basically a fixed amount paid by the insurer, by the one who has been insured before the insurance now comes in. Okay, if I've got an insurance plan, that insurance plan will involve the fact that the first medical visits that I make actually have to be covered by me before the insurance plan has to come in and make the contributions towards that insurance plan. That is what we call the deductible. Okay, and then after the deductible, you may continue to make more payments, and this can be in terms of the percentage. Okay, percentage of the medical bill that comes out. Okay, so that is co-insurance. Okay, let me repeat this. So with the deductible, I have an insurance plan. But that insurance plan will involve first spending, let us say, 100,000 SSP. So after I've spent that 100,000, that is when now the insurance starts. That is the deductible. And then when that insurance starts, I may still have to contribute a given percentage of the total cost of the covered services. It has a 20% of the services that have been covered. So the insurance company pays 80%, and then for me, I pay 20%. And that is therefore co-insurance. So you can get insurance plans from private insurance companies, which is mainly the case in South Sudan, where we have companies like UAP, CIC, and others. Those are private insurance companies. In other countries, the governments have insurance schemes, the ones we call social insurance, where everyone, as long as you're a national of that country, your medical services are paid for, okay, regardless of your ability to pay. Okay, so that is social insurance. In other situations, like in the In the US, you can have what you call public health insurance, where we have the Medicaid and Medicare. Okay. So the benefit of health insurance is that you don't know when you will get the illness. So you're not certain of that time. Okay, so when that time comes, when you get this illness, you even don't know. You don't know the disease that you get. You don't know when it will come. You don't know the cost of its treatment. And you don't know how long this illness will take. Okay, so you basically don't know. You're uncertain. And therefore, you buy health insurance to safeguard yourself against this uncertainty. Okay, so it prevents you from, or protects you from spending money from your pocket. Okay, what we call out-of-pocket expenditure. But if you're insured, it means the insurance plan will have to be implemented, and then you receive the medical services that you need to get. The challenges or the limitations of health insurance is that, of course, we have different health insurance plans. Okay, we have different health insurance plans, and some of these health insurance plans don't cover all the medical treatments or the medical services that you may need. Okay, and of course, procuring the health insurance plan depends on the cost that you're willing to pay. That is the premium. Okay, so if you are a low-income earner, you may not really get a comprehensive health insurance plan, and therefore, if you don't get a comprehensive health insurance plan, it means that you are getting some of the medical services, and you may be missing out on others. So health insurance may not cover everything. Except in cases where you have the government having everyone health insured. Okay, so they can receive any services that they really want. So the premium, actually the premium can be extremely high, and some people may not really be able to afford the premium, deductible, co-payment, and then co-insurance. Okay, so people of low income levels may not get health insurance because of the high cost associated. And then we have health insurance companies restricting some individuals who have pre-existing medical conditions. Okay, so that means that if you have a medical condition, they may actually deny you a given health insurance plan. And then there is also a limitation on if you're insured, you should visit specific health providers or specific healthcare organizations or hospitals, or you should see specific doctors. Okay, so that's the gap. You are limited in choice. So they give you a network of providers that you really have to seek services from. And then there's also a limit on the benefits that you may really have to get from your health insurance plan. So a health insurance plan covers a number of medical services, preventive medical care, preventive care, it can include vaccination, screening, and wellness visits, and then the essential medical services, such as if you're an inpatient or hospitalized patient, emergency care services, prescription, mental care, mental health, and then maternity care. So if you specialize in health insurance, you have a variety of career paths that you have to choose from. So there are a number of roles that you can really do. So you can have, you can become a claims processor, or analyst. You can become an underwriter, sales representative or agent, customer relations, customer service representative, health information specialist, compliance officer. You can become a healthcare policy analyst. You can become an actuary or insurance broker. Okay, so these are all possible job opportunities that you can have in health insurance. So we're going to look at the key roles of each of these job positions. So a claims processor is one where if I have a health insurance plan with a company, with a health insurance company X. So let us say the company is in South Sudan, and then I happen to have traveled to, let us say, Kenya, and then I get ill while in Kenya, then I get treated in Kenya, and then I come with my receipts that show that I've been treated for this condition, and this is how much I have been charged. So I come back to my insurance company to make a claim. So the person that I have to go to is the claims processor or claims analyst. So the analyst will look at my claim and verify and see whether it is accurate. And if there is any discrepancies, they may have to contact me or even contact the hospital where I received the medical services from. Okay. And then if everything is fine, then my payment has to be made. That is the reimbursement. And then we have what we call the underwriter. Okay. So the underwriter is if I want to seek for a health insurance plan, because each insurance company has different insurance plans. And if I want to get the insurance plan from this company, I will have to meet the underwriter. And then the underwriter may give me a form to fill that it contains that I provide my medical information, okay, or health information. Okay, and then the underwriter will assess the information given and then determine how much I will have to pay per month. That is the premium rates based on the risks that in the medical what that form that I have filled. Okay, so that is what happens. So they evaluate and see the risks that that are there, and then determine how much I have to pay. Okay, so they can actually accept my request for a health insurance, or they can actually reject it. The sales representative or agent is one who basically markets the health insurance plans or policies to potential clients. So they can be moving from one company to the other, meeting people, explaining to them the key features, or the benefits of each of the insurance plans that they really have. And then they basically provide that supportive information that can enable the client to make a decision on which health insurance is actually suitable for them. So they provide support, information, and they basically market the insurance plans. And then you have the customer service representative. With this one, this is like what you call the customer care. They receive queries about health insurance plans that have been provided by the health insurance organization. So if you have, if I'm considering joining, procuring health insurance plans from an organization, I can first go to the customer service representative and see the processes involved in getting the insurance, and then they can guide me on that. And then maybe if after procuring the health insurance plan, I get issues, they're the ones that I really have to call, and then they provide me with answers to the issues that I really raise. So they provide me general information about the insurance policies or plans within the organization. And then the health information specialist. The health insurance organization handles sensitive information, and this information is basically health information. So this information has to be kept confidentially, or privacy, security, and accuracy have to be taken into consideration. Okay, so this person is responsible for making sure that this data, health data or health information, is kept securely. Okay, and it complies with the regulations on insurance. And then we have the compliance officer. This one makes sure that the organization is actually complying with the regulations available on insurance. Okay, insurance has a tendency of having disputes. Okay, insurance companies and clients can have disputes. The compliance officer has to make sure that everything that is happening between the client and the organization are occurring within the stipulated laws and regulations. Okay, so this is very important, and that the procedures and the policies of the organization are implemented to the dot. And then we move to the healthcare policy analyst. Okay, this one looks at the health insurance policy and the trends, and then determine the financial impact of health insurance policy changes. And this can be used in determining the pricing, okay, and evaluate the risks and cost factors associated with insurance policies. Insurance broker, this is the person who acts between the insurance companies and then the clients. They are basically almost like the customer, the sales representatives. They're basically like the sales representative. Their roles are basically similar, but they act in between the insurance company and then the client. So if you want to gain more information, more education in health insurance, you can go for academic program or educational programs that are in health insurance. You can get a higher diploma, you can get a bachelor's degree in business, but with that has an element to do with health administration. So, at a higher level, you can get certifications as a health insurance specialist, and this may provide you with an upper hand in the job market. Okay, but of course, you can gain further competences by training, either on-job training or having to make sure that you continuously learn, okay, about the industry of health insurance. Okay, so there are two key terms that I want to explain: health insurance and then medical care and health care. What's the difference between the two? Medical care refers to when an individual gets sick, they go to the hospital. History is taken. They're examined. Okay, physical examination, and then laboratory tests can be done, or imaging can be done, and then the diagnosis is made. For example, the diagnosis can be malaria, and then they are put on treatment, and the health condition is managed. Okay, that malaria is managed. That is what we call medical care. Okay, so it's a direct service. I am sick, I go to the hospital, meet the different health professionals, and my condition is managed. That is what we call medical care. What we call healthcare is we have all these services that are provided in relation to health. Okay, so when we talk about health here, we are basically referring to the range of services that are aimed to promote overall health and well-being of populations. Okay, people. We are no longer referring to one person, but people. So we are in healthcare. That is when we talk about public health initiatives, health education, sanitization, proper sanitation, hygiene, vaccination, screening. Those are healthcare interventions or initiatives or measures. Okay, so they occur at a societal level, whereas medical care is at an individual level. So one of the things that we really need to look at is how countries have protected their citizens from catastrophic expenditure, or how many of the citizens in a given country are covered by health insurance. So we look at the statistics. So we look at the statistics such as the percentage of people who with health insurance, what health insurance plans do they have, and what is the percentage, or what are the rates of those that are not insured over time. Are we having more people that are not insured, or we are having less over time? So those are important statistics to look at. They help to identify the gaps, and then the gaps in health insurance uptake, and then be able to design targeted interventions to make sure that you have people undertaking or taking up health insurance services or plans or policies. Okay, so what do you need to look at if you're choosing a health insurance plan? Of course, you need to know the details of the health insurance plan. This is to say, you need to look at what services are really covered. How much premium do I have to pay? The deductibles, the co-insurance, the co-payment. How much is that? Okay, what medical services are being covered? And then where will I get the services from? Is there freedom for me to get services from anywhere I want, or I'm given a specific network of providers for me to get the medical services from? Okay, so what are the additional benefits associated with the insurance plan? What are other customers saying about the insurance plan? These are important issues that you really need to look at, and then before you make a decision, you may have to ask health insurance experts to provide you information on what really you need to do in choosing this plan. So for each plan that you may really need to look at, you may have to weigh each option in terms of all the aspects that I've earlier on mentioned. What are the pros and cons of each of this plan, and what is the status of your medical condition? What can fit into your budget? What are your needs? What are the experts saying? And then from there, you can make a decision. Okay, so that marks the end of this presentation. Thank you for listening.